Hello, students, and my name is Jatin Dewan, and this is my fourth lesson on reproductive health. So, let's have a glance of what we are going to read here. Reproductive health means a total well being in all aspects of reproduction, that is, physical, emotional, behavioral, and social. India was one amongst the first countries in the world to initiate action plans and programs at a national level to attain total reproductive health as a social goal called as family planning, initiated in 1951. They started educating people about reproduction related aspects such as sex education, reproductive parts, STDs, AIDS, pregnancy, abortions, contraception, menstrual problems, infertility, etc., using visual and audio aids and print media as well. Awareness about sex abuse, uncontrolled population growth, sex related crimes, etc., was also provided. There was a statutory ban on amniocentesis, which is sex determination, to stop the female feticide. The population started to explode and birth control was gotten into their possession. Our population was approximately 350 million at the time of independence, which has reached to the close billion mark by 2000. So we are just increasing our population by every passing day. There was a rapid decline in death rate, maternal mortality rate, and infant mortality rate as well. Increase in the number of people in reproducible age are probable reason for this. There was a decline in the death rate, but then the massive birth rate was increasing. Indian population growth rate is around 1.7%. Here is a graphical representation about how the population has been growing in the past years. So, what is birth control? Birth control categories include natural, traditional methods, barriers, IUDs, oral contraceptives, injectables, implants, and surgical methods. So, the most effective ones are the ones which are done just for one, like which are just done a treatment for once, and then they are of the best use. The birth control is the best with them. So the best ones we have here are implants, vasectomy, tubectomy, and IUDs here. And then decreasing here are spermicides, which are the least effective ones. They don't stay for longer and you have to use them every time you have sex. So there are natural methods which work on the principle of avoiding chances of ovum and sperms meeting. There is periodic abstinence, avoid to abstain from coitus, that is from the day 10 to the day 17 of the menstrual cycle, when ovulation could be expected. Then there are chances of fertilization is very high in this period, so it is best to avoid this period. Then withdrawal or coitus interruption. The male partner withdraws his penis from vagina just before ejaculation so as to avoid insemination into the vagina. There is lactational amenorrhea, no menstruation during lactation period. Chance of fertilization is nil. It is effective up to 6 months. There are several barrier methods whose working principle is to prevent the meeting of sperm and ovum, like condoms, diaphragm, cervical caps, walls. So they're the best barriers for avoiding the birth to young ones. Then there are IUDs. These are devices which are only used by females. They're inserted by a doctor or by experts, and then they're inserted into the vagina, into the uterus through vagina. Non-medicated IUDs are like lips loop and copper releasing IUD like CUT, CU7, multilode 375. So the working principle of these is that Cu ions are released and they suppress the sperm motility and fertilizing capacity of the sperm. There are oral contraceptives as well, in which you have to take pills and other capsules. They are used in the form of tablets. So they are used more majorly by the female patients and the females only. So they contain the progesterone and progesterone estrogen combination. Saheli is a non-steroidal preparation used as oral contraceptive. These inhibit the ovulation, inhibit implantation, and after the quality of cervical mucus to prevent and retard the entry of sperms. Now let's move on to surgical methods. There are two kinds of surgical methods. One is vasectomy and the other one is tubectomy. So it is also called as a sterological method. It is advised to both male and female partner. So permanent or terminal method to prevent pregnancy. Sterilization process in male is called vasectomy, wherein sterilization process in females is called tubectomy. In vasectomy, a small part of vas deferens is removed or tied up, wherein in tubectomy, a small part of fallopian tube is removed. And the reversibility of it is extremely poor. MTP, that stands for medical termination of pregnancy. It could be intentional or voluntary termination of pregnancy before full term, and it is called as medical termination of pregnancy. MTP has significant role in decreasing population. It accounts for 1/5 of the total number of conceived pregnancies. There is a legal restriction only to reduce female feticide. So MTPs are no longer advised or done easily. The method is safe with first trimester. So do not try in the second trimester as the chances get worse. Now comes the sexually transmitted diseases. Sexually transmitted diseases are also abbreviated as STDs, which are transmitted through sexual intercourse, also called as venereal diseases or reproductive tract infections. Gonorrhea, syphilis, genital herpes, chlamydiasis, genital warts, trichomoniasis, hepatitis B, HIV are some common STDs. Except hepatitis B, genital herpes and HIV infections, so except for these three here, all are curable. The symptoms which occur are fluid discharge, itching, slight pain, swelling, and in the genital region. STDs remain asymptomatic in female and remain undetected for long. In the later stage, it may lead to PID, that is known as pelvic inflammatory disease, PID, abortion, stillbirths, ectopic pregnancy, infertility, or even cancer in later stages. So, to prevent, what can you do? Avoid sex with unknown partners, multiple partners, always use condoms during coitus. In case of doubt, consult with qualified doctor for early detection. Get complete treatment if diagnosed with disease. Infertility, the couple unable to produce children in spite of unprotected sex. This is also a major reason of infertility, that there could be physical congenital diseases, drugs, immunological, or psychological problems involved that could be either in male or the female. Infertility clinic can diagnose and correct cause of infertility. The problem can also be solved through certain special techniques available worldwide known as assisted reproductive technologies, which is also abbreviated as ART. In vitro fertilization outside the body, almost in similar condition as that in body, followed by embryo transfer. Zygote intrafallopian transfer, ova from female and sperm from male is fertilized into in vitro and then transferred into fallopian tubes. So this is also called as ZIF. There is intrauterine transfer. In intrauterine transfer, embryos with more than 8 blastomeres are transferred directly into uterus to complete its further development. If you see here, so the transfer happens here. Then there is in vivo fertilization. The other one we read formerly was in vitro. This is in vivo. So in vivo, fusion of gametes happens within the female. The gamete intrafallopian transfer, it is also known as gift, transfer of ovum collected from donor into fallopian tube of another female who cannot produce one but can provide the suitable environment for fertilization and further development, often known as surrogacy. So, intracytoplasmic sperm injection, it is also known as ICSI, that is the initials for all the four words. The sperm is directly injected into the ovum, and after in vitro fertilization, either ZIFT or embryo transfer technique is followed. The last one here is artificial insemination. The sperm is collected either from husband or healthy donor, is artificially introduced either to vagina or into uterus, which is intrauterine insemination. I hope you were clear with all the topics, and I hope you shall make a list of the abbreviations and memorize them for better understanding. And if you have any doubts, please comment. Thank you.